as per the instructions of Sri V. Prasanna Venkateswara sir, IAS, District Collector Magistrate, we are very happy and today for organizing blood donation camp under the personal supervision of Government Hospital Blood Center, Iluru. Further, Sri Dr. AZADI Mohan Garu, DCHS, had given consent to attend this camp as guest of honor. We are going to enlighten the regulations of Drugs and Cosmetic Act 1940 and Rules 1945 as the whole human blood IP is the drug as per Section 3B and also special provisions laid down in Schedule F, Part 12B for the functioning and operation of blood center by following good operating process and distribution and sale to the needy patients on the prescription by the qualified doctors. We are going to enlighten these provisions on the part of raise awareness of drug regulations through social media under AZADI Ka Amrit Mahotsav.
Very good morning, everybody. First of all, I'd like to thank Vijay Kumar Garu, Sunita Madam, and all other team, PVs and druggers. ఎందుకంటే బ్లడ్ డొనేషన్ అనేది ఒక మహాకార్యం. మనకందరికీ తెలుసు, అన్ని దానాల్లో కల్లా రక్తదానమే మెయిన్. అట్లాంటి మంచి కార్యక్రమాలు చేయగలిగిన ఫస్ట్ ఈ డ్రగ్ డిపార్ట్మెంట్ ని అలాగే కెమిస్ట్ ని డ్రగ్స్ అందరూ కూడా నేను హృదయపూర్వకంగా అభినందిస్తున్నాను. ఐఎమ్ వెరీ హ్యాపీ దట్ బ్లడ్ డొనేట్ చేయడమే కాకుండా ఈ బ్లడ్ డొనేషన్ గవర్నమెంట్ హాస్పిటల్ గవర్నమెంట్ ఇన్స్టిట్యూషన్ ఇస్తా ఉన్నారు. సో మనకి ఏంటంటే ఈ పేద ప్రజలు ఎక్కువ మంది వైద్యం కోసం వచ్చేది బ్లడ్ రిక్వైర్మెంట్ ఎమర్జెన్సీస్ ఎక్కువ అవసరమైనది మన గవర్నమెంట్ హాస్పిటల్స్ లోనే. ఈ బ్లడ్ అంతా వాటెవర్ యూనిట్స్ ఆర్ కలెక్టెడ్ ఇవన్నీ కూడా ప్రాపర్ గా నీడీ పర్సన్ కి డిస్ట్రిబ్యూట్ అవుతాయని చెప్పడానికి చాలా సంతోషిస్తున్నాను.
Blood is an emergency life-saving drug which cannot be manufactured by any company in the world except human body. Blood transfusion is essential to the patients with chronic illnesses, undergoing major surgeries, cancer treatments, and traumatic injuries. Any healthy individual in the age group of 18 to 65 years with normal blood pressure and having hemoglobin levels not less than 12.5 grams can donate blood for every 3 months. A person can donate 168 times in his lifetime. Who can conduct blood donation camps? Licensed designated regional blood transfusion center, licensed government blood center, Indian Red Cross Society, licensed blood centers run by registered voluntary or charitable organizations recognized by SBTC. Blood is the most precious gift that anyone can give to another person, the gift of life. Donate blood, save life.
Ministry of Health and Family Welfare Department via GSR 166C dated 11/3/2020 amended the word blood bank as blood centers. As we all know, every individual aged 18 years to 65 years can donate their blood. Individuals suffering from HIV, hepatitis, cardiovascular diseases, kidney infections, liver infections, asthma, leprosy, epilepsy, diabetes, digestive disorders, sexually transmitted diseases and other endocrine disorders should not donate their blood. The Ministry of Health and Family Welfare Department via GSR 166E dated 11/3/2020 has added the many other conditions or diseases during which the blood donation should be avoided. Especially in women, pregnant and breastfeeding women should not donate their blood, and during the menstruation cycle also the blood donation should be avoided. Psychiatric patients suffering from anxiety, mood disorders and schizophrenia are not supposed to donate their blood. After any minor surgery for 6 months and after any major surgery for 12 months, donation should be avoided. In case of other infectious diseases such as measles and mumps, for 2 weeks blood donation should be avoided. In case of malaria, for 6 months, and in case of typhoid, 12 months, blood donation should be avoided.
Blood components shall be prepared by blood banks as a part of their services. There are different types. First is packed RBC. Packed RBC shall be prepared from the whole blood if the blood is stored in ACD solution within 21 days and if the blood is stored in CPDA solution within 35 days from the date of collection. After processing, they are stored at 2 to 6 degrees temperature. Packed RBC is used in patients who lost large amount of blood and in anemic patients causing notable symptoms. Second is platelet concentrates. It is prepared from 1 unit of blood. The source material for platelets shall be platelet-rich plasma or buffy coat, which may be obtained from the whole blood or platelet apheresis. Immediately after processing, they shall be stored between 20 to 24 degrees centigrade for not exceeding for a period of 5 days. Platelet shall be used in patients with low platelet count or with platelet dysfunction. Third is granulocyte concentrates. They are prepared from blood by automatic apheresis, therefore known as granulocyte apheresis concentrates. After processing, they are stored at 20 to 24 degrees centigrade for a period of maximum 24 hours. They are used in chemotherapy and bone marrow transplantation patients who develop microbial and fungal infections which does not respond to antimicrobial agents. Fourth one is fresh frozen plasma. FFP is prepared from liquid portion of the whole blood. It is stored at a temperature not more than -30 degrees for a period of not more than 1 year. FFP is used to treat patients with low blood clotting factors. Fifth is cryoprecipitate. Cryoprecipitate is a frozen blood product prepared from blood plasma. It is stored at a temperature not greater than -30 degrees centigrade and for a period of not more than 1 year from the date of collection. It is used to control bleeding in patients whose blood does not clot properly.
Apheresis is a procedure in which the whole human blood was collected into a specific apparatus where the sum of the components of the blood such as platelets, plasma and white blood cells are taken out and the rest of the blood was returned to the donor body again. Apheresis procedure was categorized into 3 types: plasmapheresis, plateletpheresis, leukapheresis. Plasmapheresis in which plasma only divided from the whole human blood. In plateletpheresis, platelets are divided from the whole human blood. In leukapheresis, the white blood cells are separated from the whole human blood. For conducting apheresis procedure, the following conditions has to be maintained. Before conducting the apheresis procedure, hemoglobin estimation, differential count, WBC count, platelet count has to be done to the donor. Plateletpheresis shall not conduct on donors who have taken aspirin within 3 days prior to donation. In case of plateletpheresis, a 48 hours gap must be given between 2 successive apheresis procedures. The apheresis procedure shall not conducted not more than twice in a week. In case of plasmapheresis, the quantity of plasma separated from the donor shall not exceed 500 ml per sitting. In case of fortnight, the quantity of plasma separated shall not exceed 1000 ml per month. In case of repeated plasmapheresis, plasma protein of the donor shall be more than 6 gram per ml. 4 types of blood products are prepared from the whole human blood. These are albumin, plasma protein fraction, immunoglobulins, factor VIII concentrates, and these premises shall comply the provisions of the Schedule M of the Drugs and Cosmetic Act 1940.
రోడ్ ట్రాఫిక్ యాక్సిడెంట్స్ కానీ తర్వాత గర్భిణీలకి డెలివరీ టైంలో మరి రక్తం అవసరం అవుతుంది. అదేవిధంగా బర్న్స్ కేసుకి అవసరం అవుతుంది. తర్వాత ఇప్పుడు మనకి 1048 అన్ని చోట్ల విస్తరించింది. వాటిలో భాగంగా ప్రతి చోట ఎక్కడైతే యాక్సిడెంట్స్ అవుతున్నాయో వెంటనే హాస్పిటల్స్కి వాళ్ళని తేవడం, వెంటనే అవసరం బట్టి మరి ఈ బ్లడ్ డొనేషన్ అన్నది చేయడం జరుగుతుంది. మీరందరూ కూడా మరి ఈ గవర్నమెంట్ బ్లడ్ బ్యాంక్ని చూజ్ చేసుకోవడం కూడా ఒక విధంగా మరి పూర్వీకులకి బెనిఫిట్, ఈ బ్లడ్ డొనేషన్ ఇవ్వడం వలన బెనిఫిట్ అవుతుంది.